or any place in the country that has higher blood pressure because they've been misled to believe that there are euthanasia panels or death panels in this bill. That is an absolute myth, and I think it's wrong to do that. In terms of abortion, you may know Henry Hyde. The law on federal funding of abortion was written by Henry Hyde, who's one of the most respected pro-life leaders that the country's seen in my time in Congress. This is what the present law says under the Hyde Amendment. It says that no federal tax dollars may be spent on abortions with the exceptions of rape, incest, or saving the life of the mother. This bill will continue that Hyde law. And I will watch that carefully. And if anybody tries to change the continuation of the Hyde law, I would work to put the Hyde language back in it. So I have read the bill, and there are no death penalties in it, and the law will continue the Hyde Amendment.
Ladies and gentlemen, the next person to ask a question will be Jim Alexander of Cleburne. After Dr. Alexander will be Sue Fielden from Clifton in Bosque County.
Thank you, Dr. Congressman Edwards, for being here tonight. Appreciate that.
Thank
A
you,
lot of very important questions have been brought up tonight, and all of them are very appropriate. Just a little background on myself. First of all, I'm a physician. I have served in the United States Navy. I've taken care of VA patients. I've been in private practice here in Cleburne. Was in private practice 10 years here in Cleburne. And then I got involved as medical director for the Texas Medicare program, and from 1997 to 2002,
Jim, the Texas Medicaid program?
Medicare, sir.
Medicare program,
Right.
Okay.
And Part A and Part B, and from 97 to 2002, I was the chief medical director for Texas Medicare. One of the things I want to say is I appreciate the remarks you made about Medicare. Medicare is an excellent, excellent system. It's not perfect. There is no perfect healthcare system. Not in this country, not in any country. But Medicare does a very good job. Part of the problem with Medicare costs so much now, and so much has been added to the Medicare program since 1965, when it first was put forward. Originally, it was just for hospital care and doctors, and now we know we have all these other things. Plus, we have all the research that's being done to discover new things, which always brings the price.
Right.
So, and I also agree totally with you that we have to make sure that we pay the cost as we go ahead. One of the things that I needed to ask as my main question was the way I feel about it. Medicare serves our citizens over 65 and the disabled.
Right.
And most people are very satisfied with their Medicare coverage. We've heard that several times before. To me, the public option is just a logical extension of
We'll respect your right to ask questions. Please respect this.
It's just a logical extension of a choice that people should have who, if they can't find coverage anywhere else, could buy into it. Now, as I understand it in the bill, that the public option is not going to be Medicare, but it may be similar to Medicare with coverage policies and such like that. It will, the way it's been set out in the bill as I read it, is that it will pay doctors at a higher rate. That's part of it, because of some of the issues related to physician reimbursement.
Right.
So my question is, why do you think there's so much opposition to the public option when the true public option we now have, the Medicare, our national Medicare system, is so highly regarded?
First, thanks for your military service and for your continued public service in healthcare. to answer your question, based on the 28 meetings I've had in our district the last 3 weeks, I think the concerns around not only the public option, but the overriding concern about the bill itself is people have a great concern about whether this is going to ultimately be a Canadian-style, socialized, one-payer, single-size-fits-all healthcare system. And I respect those concerns. I think those are very, very valid, and we do need to be careful. Again, there's some on one end that want the government to do it all. I don't agree with them. There's some on the other end who honestly want to get the government completely out of health care, and I think that'd be devastating if you got rid of the Medicare and Medicaid programs. I think the concern is over the extent of federal involvement, and I would say this about Medicare. Medicare is a government-run healthcare program, and most seniors have great regard and appreciation for their Medicare program. I think whatever we do or don't do, what's important in this public-private partnership is we maximize the choices of seniors in Medicare, and I want to be sure that they continue to be able to choose the doctor of their choice and have the widest possible options of health care. And I want, as Medicare does to a large degree today, allows the doctor to make that decision, not the government bureaucrat somewhere. I think that the problem with having everyone uninsured put on the Medicare program, one, could be cost, and two, I think it would come awfully close to looking like to the American people and people of our district like a Canadian-style plan. I think the approach of this bill is to try to keep the private employer basis of our healthcare system, but where people are falling through the cracks, the employer doesn't provide healthcare, they have a pre-existing condition. Help these people through the insurance exchange, get lower cost insurance, get rid of the discrimination against those that have pre-existing conditions, and with some of the savings and revenues in this bill, subsidize those families that are middle income or low income to get more of them out of the emergency rooms that you know better than I are the worst place to provide primary care, get them into the doctor's offices. I met with Dr. Roland Gertz from Waco. I don't know if you ever met Roland. He runs the Family Medical Center in Waco. He said that studies have shown if you just get a family with a medical home, a medical doctor, you can save healthcare costs up to 19% a year. And so I think this plan may not be approaching the problems of the uninsured exactly the way you'd suggest, but I think it's trying to reduce the number of uninsured, get them into a medical home, get them out of emergency rooms, and then we all benefit from the savings from that, including those of us who are paying health insurance. But thank you for your comments. Thank you for your military service.
Next person to ask a question will be Sue Fielden from Clifton, Texas. After Sue will be Randy Haney from Glenrose.
I do not agree that Medicare is a well-run government program. Originally, there was an annual deductible on Medicare Part A. In 1965, that annual deductible was $40. By 1990, it was $592. The Part A deductible was eventually changed to a deductible per benefit period, which now is 1 to 60 days. For 2009, the deductible per benefit period is $1,068. Most people do not even understand what Medicare covers and what it doesn't. It is a government program with policy and procedures and guidelines, all written in government speak, mumbo jumbo. The 1,018-page health care bill, or a bill of any size, if passed, will multiply by thousands of pages of policy and procedures and never-ending revisions, and a huge number of bureaucrats in multiple newly formed government agencies.